My name is Sandy Hart. I'm the chair of the Lake County Board, and on behalf of my colleagues who serve on the board, thank you so much for joining us tonight and for submitting your questions and comments. This is really an incredibly challenging time. Our friends, our neighbors, and maybe some family members are out of work and potentially sick or even in quarantine. Small businesses are closed, and I think there's a lot of confusion out there about how long this is going to go on for. I've heard people say, you know, I don't even know if it's really necessary. Nobody out here where I live even appears to be sick. And then on the other hand, my neighbor is working in the ICU, and one of her roles is helping people say goodbye to loved ones because they can't get into the hospital. So it's a really difficult, extremely trying time for everybody. Whenever there's a lot of uncertainty like this, it breeds a lot of anxiety. So if you find that you need someone to talk to right away and potentially during this conference, I hope you will call 211 and you'll be connected right away for someone to help you. So we're all really ready for things to get back to normal, but of course that needs to be balanced with the things that are going to keep everybody safe. So I am honored to work with Donny Schmit, the president of Lake County Municipal League, and he also serves as the mayor of Fox Lake. So I will turn the microphone over to him. Donny?
Again,
he's muted.
Oh, am I talking now? Okay.
Yes.
I want to thank the leadership of the Lake County Board and the board members for putting this town hall meeting together. I also want to thank the Lake County Health Department, Lake County Partners, and as the father of a disabled veteran, a special thanks to the Lake County Veterans Assistance Commission. Certainly an honor to be working with such a dedicated group of people. I'm going to speak for a minute from the municipal standpoint. We're in uncharted territory with this COVID virus. Each mayor and village board or city council takes their responsibilities very seriously. We all face the same challenges that all of you do. We pay the same taxes, the same water bills, and most of us have been affected in our jobs by the COVID virus. The numbers that are read every day are not like the stock markets. They go up one day, they go down the next, and then life goes on. These numbers represent grandmas and grandpas, moms and dads, sons and daughters. And it doesn't matter where they live, their age, their pre-existing health conditions, they're fellow human beings and their lives matter. Our municipalities are responsible for providing services. There's two types of services that municipalities provide. The first is emergency services, such as police and fire protection and 911 service. When you call 911, you expect someone to answer the phone. And when you need help, you expect the fire department and the police department to show up. Second type of service that the municipalities provide are essential services, like sewer and water. When you turn on the water faucet, you want water to come out. When you pull the plug in the bathtub, you expect it to drain. Each municipality has different financial circumstances, and we're all doing everything we can for our business and residents. That's not the same for every municipality. Some municipalities have to borrow money in order to meet their obligations, and others have bigger reserves. But whatever the situation, your mayors and board and council are residents of your community and facing the same struggles as you are and doing all they can to ease the burden on the residents and the businesses. The executive director of the Lake County Municipal League, Mandy Florup, is providing municipalities and townships with information and guidance on a daily basis. The league is also part of several groups, including the COVID Recovery Task Force. This task force is composed of representatives from Chicago, all the collar counties. It's made up of financial, medical, and municipal leaders. Common areas of concern and recommendations for recovery are the main focus of this group. When we speak as a region to our leaders in Springfield, the message is clear: recovery can be successful. I want to once again thank everyone on the panel for your dedication. This isn't easy for anyone. But working together with compassion and understanding, we'll get through this and be stronger for it. I thank you for having me on this panel. And now it's my pleasure to introduce Mike Pfister, the Executive Director of the Lake County Health Department. Thank you. Mark? You're still muted, Mark.
Yep.
There you go.
Great. Good evening, and my name is Mark Pfister. I'm the Executive Director of the Lake County Health Department and Community Health Center. And on behalf of the Lake County Board of Health and the Lake County Department of Community Health Center, we thank you all for participating tonight. So as you all know, is that Lake County reported our first case on March 11th. And as of today, we have the third highest number of cases in Illinois, next to Chicago and suburban Cook County, with 4,837 cases and 161 deaths. Unfortunately, about 2/3 of our deaths are linked to long-term care facilities, and a growing number of our cases are among our vulnerable populations. So since the start of this crisis, we've had a dedicated team of staff working around the clock to protect public health during the COVID-19 pandemic. We are constantly monitoring the pandemic, assessing the needs of our community, and working closely with Lake County government and our community partners like the mayor to address those needs. Issues like food, housing, and providing personal protective equipment to protect our frontline workers. The health department's communicable disease team is investigating every confirmed case of COVID-19 and guiding individuals, businesses, and organizations to prevent further spread of the illness. Our awesome Joint Information Center is working to keep the community informed so all residents know how to stay healthy and have resources they need. The health department continues to provide services to the community to the greatest extent possible. But really what I want to do tonight is really thank all of you Lake County residents for all that you've been doing for the last 6 weeks. You've been staying home, you've been staying well. I know it's tough, but it's absolutely requisite that we have to do that. I also want to express our profound gratitude to our essential workers, our public health professionals, our healthcare workers, our first responders, and all the essential workers that are supporting critical infrastructure like our grocery stores, restaurants, gas stations, and childcare workers who are really keeping our society running. But for every resident, I really request that you stay home if you can. Wash your hands frequently, keep your social distance of 6 feet from others, wear a face covering when out in public, and please follow the governor's stay-at-home order and guidelines closely. Additionally, Kevin's going to talk tonight about our businesses, and our businesses really have a great responsibility to keep our essential workers and customers safe. We are asking you to make sure your employees and customers can continue to follow these guidelines while in your facilities to stay healthy. The health department, we've been working for you, and we will continue until this pandemic is a memory. So I just want to say we're all in this together, and the success of our efforts as a county, as a municipality, as other community partners, really our success depends on you. So I just want to say thank you for working with us and make sure that we stop and slow this curve. So thank you for everything you're doing. And now I'm pleased to introduce Andrew Tangen, the Superintendent of the Lake County Veterans Assistance Commission.
Thanks, Mark. Good evening, Lake County. I'm Andrew Tangen, the Superintendent of the Veterans Assistance Commission of Lake County. The COVID-19 pandemic has had a unique impact on our veterans. First, and especially in Lake County, approximately 55% of our veterans population is over the age of 65. Prior to the National Emergency Declaration on March 13, 2020, I made the executive decision to end in-person appointments with my constituents or veterans. This was done due to the data that had been received from local, state, and federal leaders, and from various infectious disease experts and media reports on outbreaks in Italy. My staff and I continue to provide the high level of customer service to our veterans, to include representing veterans in front of various bodies, to include the Veterans Benefits Administration, the Board of Veterans Appeals, and the Court of Appeals for Veterans Claims in a remote setting, One of the great successes to come out of COVID-19 is the proof of concept that veteran advocates like me and my staff have been advocating and aggressively pushing for years, which is to be able to connect hearings on veterans cases remotely. In the past, veterans were required to appear before a veterans law judge for an appeal either in Washington, D.C. or at one of the sporadically located regional offices throughout the country. There is always a better way to accomplish hearings, and this office and the technology I'm speaking to you on right now was specifically built with that goal in mind. Due to the restrictions placed on all entities, we have been able to represent several veterans at various levels of appellate review for wrongfully denied claims during this trying time, exactly how I am coming to you. The Commission has successfully processed so far claims and appeals totaling approximately $2.5 million in new benefits so far brought into Lake County this year paid to our veterans. This has come as a lifesaver to many of our veterans, but especially our younger veterans of the Iraq and Afghan wars who have had to exit the workforce due to lung injuries they sustained from toxic fumes they were exposed to via burn pits and oil fires in Iraq and Afghanistan. Further, we have mobilized our network to assist veterans who are homeless or in critical danger of becoming homeless by relying on the partnerships we created that led Lake County to become functional zero in homelessness last year. This partnership, which comprises the VAC, the Lake County Sheriff, the Lake County Community Development, the Captain James A. Level Federal Healthcare Facility, PADS, Lake County Response for Veterans, the Lake County Veterans and Family Services, Lake County State's Attorney Mike Neerheim, and the 19th Judicial Circuit developed the event 3 years ago. As this program was already in place and was set up with local hotels to include the Holiday Inn Express in Waukegan, we were able to assist those veterans impacted by the COVID-19 pandemic. During the pandemic, the VAC has been able to house over 25 homeless and near homeless veterans for a total of 241 cumulative nights. Finally, our partnership with the Midwest Veterans Closet continues strong, and the Veterans Closet is still providing food and other valuable resources to our veterans. We had many questions about those veterans in need are being fed. Mary Carmody and the staff at Midwest Veterans Closet has worked tirelessly to assist our veterans in need, and if there's any desire for food donation, the Midwest Veterans Closet is definitely in need. This has been a trying time for us all, but we have worked countless hours and weekends to ensure my constituents and brothers and sisters in arms are taken care of and provided for during this time. We're all in this together, and we will all get out of this together. If any of you need help, do not hesitate to ask. It is my pleasure to introduce and turn this over to Kevin Constantine with the Lake County Partners.
Thank you, Andrew. You know, the state of the Lake County economy, on the surface, it looks like it's completely stopped. But if you peel that back a little bit, there's actually quite a bit going on. Most of our manufacturers are operating, and we're deep in a number of industries that are considered essential, especially our medical device, pharma, and automation sectors. As Mark mentioned, they're required and encouraged to operate safely, adjusting shift and break schedules, providing masks where appropriate, and encouraging those who can work from home to do so. We are truly grateful for all the folks that have kept our essential businesses humming through all of this. Our professional services and corporate office folks, that's a slightly different story. Some might have skeleton crews in the office doing some work that can't be done from home, imagined lab or R&D work. But otherwise, about 80% of those folks are operating remotely. Obviously, the retail sector has been the hardest hit, especially our restaurants, as we're all aware. Many, if not most, of our 5,000 retailers, including 1,500 restaurants in Lake County, are closed or are operating with reduced staff and service. We have seen many folks called back once their company's business assistance loans have come in. We're really encouraged by that, and we're looking forward to seeing more of that. Speaking of business assistance, there's financial assistance. There's quite a bit of it out there from both the federal and state sources. The most well-known of those programs is the Paycheck Protection Program, or the PPP. So far for Illinois as of May 1st, the numbers there include 160,000 loans for over $22 billion to Illinois businesses. But most important is that there is still money left in the program. In fact, as of 5 o'clock today, there was $140 billion still available for businesses to apply for. So we encourage you, if you haven't applied yet for the Paycheck Protection Program, please do so. If you've applied and you haven't heard back from your financial institution in a while, give them a call. If you don't hear back, go ahead and apply through another channel. The money is there, it's available, and it'll be a big help. There are other programs available through the Small Business Administration. You've probably heard about the Emergency Injury Disaster Loan, or the EIDL program. There are also a number of small business programs through the state of Illinois. The Small Business Development Center at the College of Lake County has done a fantastic job in collecting all these programs into their guide. You can find links to that as well as the other programs that I talked about at the Lake County Partners website, which the link there will be posted in the rail on the right side. We also have guides there for opening back up. So we have guides there for office, industrial, and retail environments, checklists for opening back up the business, and things to consider in opening, not only preparing the facility, but also preparing your workforce. Let's remember that the strengths of Lake County, the attributes that make it a great place to grow your business, your career, or your family, those things haven't changed. The primary strength of Lake County is its workforce, and that hasn't changed. Many of us undoubtedly have been impacted by the epidemic, as so many of us have talked about today. And while the hardships are truly devastating, we do believe that they'll be short-lived. Our highly educated, highly skilled workforce, the scientists and machinists and welders, product managers, sales reps and chefs, and so many more, are truly the envy of regions around the country. When you look at our schools, and truly graduations for the class of 2020 are going to look a little different this year, but our schools, the best in Illinois, where 60% of our high school students go to a nationally recognized high school, they continue the tradition of graduating a new class ready to change the world. Lake County is deep in industries that are leading the entire country through this difficulty. If you ask any economist which industries are going to come out of this stronger, atop every one of those lists are life sciences, medical devices, and distribution and logistics, all sectors where Lake County shines. Most of us have discovered the importance of supply chains, e-commerce, and distribution over the last 8 weeks. And do you know that the 5th largest distribution center in the world is currently under construction in Grays Lake, set to open early next year and bring hundreds of new jobs with it? Another thing we're known for is open space, including over 30,000 acres of forest preserves that frankly have never felt more vital than they do right now. We might have miles to go before we sleep, but there truly are reasons to be optimistic. Chair Hart, back to you.
Thank you. And I do have a graduate this year, and it does look very different. So thank you. So we really hope for the people who are here and listening tonight that some of your questions will get answered, and we'll show you that Lake County government and our partners are working hard for you every day. So before I begin, there are several questions that were submitted that we here in Lake County, whether they're in a municipality or at the health department or Lake County government, we have no control over those. So real quick, the opening of pools and restaurants, churches, camps, specific businesses, recreational opportunities, those are decided at the state level. So Governor Pritzker recently sent out a plan, I think it just came out yesterday, that is called Restore Illinois. And it shows 5 stages that people have to go through to open our state. And that's based upon regional healthcare availability, and it recognizes how COVID-19 has impacted regions differently across Illinois. If somebody wants to take a look at that, you can easily Google Restore Illinois and you will find it. So we will get right into the questions. Thank you so much for the people who have submitted questions. I know several more are coming in on the chat, and our communication team are tracking those down. Our first question is for Mark, our Executive Director of the Lake County Health Department. Where do I go to find information about cases, and have we reached the peak in Lake County?
Yeah, that's a great question, Chair. And actually, every day we update what is known as our coronavirus data hub. And so I'll have staff put out the link in the chat function. So they can go there every day. They can see the cases. There's a map that shows how many cases are there by municipality. It's shaded to show what the prevalence based on population is. And so to the other question about have we reached the peak, you know, our rate of infection seems to be plateauing, but it's really not on the decline yet. And so we're averaging about 150 cases per day. And we have just added additional testing capabilities, both with the community-based testing center, as well as additional providers are doing testing. So more testing we have, we expect to see an additional increase in cases over time.
Great, thank you very much. Next question is for Andrew Tangen. How is the VAC helping veterans and their caregivers during the pandemic? Things like food and medical care were.
Yeah, it's a very good question. So one of the things that that we have in the VA enterprise, the veteran enterprise, a lot of family members end up being caregivers for veterans in life, as is the way across the population. But the VA actually has funds for care. So if you are a caregiver for a veteran and you need a break, there are resources available. My office has all the data on that. We might get a couple other questions on caregiver stuff tonight, so I'm not going to put it out right now. But there are benefits available. Also, we are working for our veterans today. We are still working on every single case that comes into our office for compensation or pension or any other type of medical need. So we are fully staffed, fully functional, able to handle your case, review your case, and provide advocacy work for you in front of any one of the levels of bodies that are required for that situation. Also, in regards to food, like I covered earlier, the Midwest Veterans Closet is open and fully functional and is standing by to provide food to our veterans, and also standing by to accept donations for anyone who would like to donate foods or other items that they might think might be relevant and pertinent to helping veterans in mid to lower income get through this.
Andrew, you got muted somehow. Did you want to add anything else, Andrew? Did you want to add anything else, Andrew?
Thank you.
Okay.
No, not right
Thank you.
now.
Thank you. The next question is for Kevin. Okay, thanks. Next question is for Kevin. I am ready to reopen my business per state guidelines. Where do I learn what they are, and where do I get supplies to keep my employees and customers safe?
Those are good questions. There are a handful of things that businesses need to look at in addition to the state guidelines. We have several checklists on our website, depending on what type of business you are opening, which will give you a lot of guides on not just about opening the facility, preparing your workforce, how to think about establishing social distancing within your facility, and being able to map that and communicating with your customers. You'll find those on our website, as well as there is a list of potential suppliers that's been sourced from a number of our municipal partners. So we have sort of a crowdsourced list of suppliers available there on the website.
Perfect. Thank you. Next question is for Mark. What is the health department's process once they learn of a COVID-19 case out in the community?
Well, that's what we do right away. Is every time we get a positive case, we do what is known as contact investigation. And so contact investigation is where we actually reach out to the individual that was positive, and then we start talking to them. We provide education, we provide information and support. But really what we do is we ask them questions about their illness. We start with what are the symptoms that you've had? When did those symptoms start? Medical situation, or what was your travel history? And we also ask about others at home or who they work with. And so then what we do is that once we find out who else they've been in contact with, we also do contact tracing to identify others who may have been exposed. And so once we know those individuals, then staff really help the infected person recall where they have been and who they have seen while they're infected. So staff reach out to those contacts to inform them that they may have been exposed to COVID-19. But obviously we wouldn't say to those individuals who that individual was that may have exposed them to COVID-19. And so then we ask them to isolate themselves from others and watch for symptoms for 14 days after their last exposure. We may sometimes have a contact also get tested COVID-19, and if they are tested positive, then we do the same thing for that individual and try and determine all the individuals that they were in contact with.
I didn't
Chair
hear
Hart-
anything.
Chair Hart,
Sorry,
we couldn't-
sounds like
Sandy.
I lost.
Oh.
I know, I'm sorry. This is for
Oh,
Andrew.
okay, there you go. Was that for
and
me
I'll
or?
say thank you.
Oh, okay,
No, this is actually for Andrew.
You're off
And I'm going to
again.
thank Mayor Rotering for letting me know that I am. Oh, for goodness sake.
now you're on.
Okay,
Yeah.
thank you. I'll thank Mayor Rotering out of Highland Park for her help with that one. So this is for Andrew. What if a veteran in my family lost his or her job and insurance due to COVID-19 and needs medical help?
So if a veteran needs medical help and they lost their job and insurance due to COVID-19, as I discussed earlier, there are quite a few younger veterans who are veterans of the Iraq and Afghan wars who were exposed to toxic chemicals in burn pits or oil refinery fires and are in the higher risk category for COVID-19. We can help that veteran get into the VA system. So we can help that veteran fill out the required paperwork and get them the medical care that they need that will be covered virtually, and will be able to get them a primary care doctor and referred to a specialty clinic for whatever issue that they have in the VA system in this current situation without them having to travel to the VA at all. So if there is a veteran in that situation in Lake County, please have them contact our office, and I'll have staff post our contact information in the chat so that any veteran who is in that situation, because there are quite a few who have already contacted our office, can contact our office, and we can start the process of getting them that required medical care and getting them to the VA at no cost or minimum copays through the VA system.
Perfect. Thank you. Next question is for Donny. How has this pandemic affected how the villages and cities in Lake County are working?
Well, we've had to find alternate ways to provide the essential services that I had talked about earlier. We have to abide by the governor's orders and ensure the safety of our employees. We've had entire police and fire shifts become contract the COVID virus, so we've had to scramble with employees. We're asking our officers and police and fire to put themselves in harm's way to serve the public. Village staff and officials have made ourselves available to residents. Even though the village halls are closed, if you call us, we'll still respond. the best estimates are that we're going to lose 30% of our revenues for this year. So already in my town and every other mayor I've talked to, we've reduced budgets, we've cut programs, we've cut events, and hopefully that's all we have to do. But either way, the state's delays our revenues from coming in, and it's the same as a family budget. When the revenues decrease, you make the adjustments you have to, and still provide all the services that our residents and businesses have come to rely on. And that's it.
Thank you, Donny. The next question, I think I'm going to turn over to one of our staff members, Cassandra Torstensen. The question is, what is the county doing to help our residents? How about for people who can't leave home, or people experiencing homelessness or domestic violence victims? Cassandra? I'll come back to that question. And if you're on your phone, Cassandra, for your audio, you hit *9. So I'll come back to that question. Next question is for Mark. How are you supporting long-term care facilities?
So what we're doing is that for every long-term care facility, and we're almost up to 40 that we're working with directly that have had 2 cases or more, and that could be a staff member or a resident. But one of the things that we have is we have a liaison that is assigned to every facility that is providing guidance daily. And then we also have a dedicated case investigator that's assuring that those long-term care facilities are using or have the appropriate PPE. We do daily monitoring. We do contact investigations if there's any new cases. But we're also working with the Illinois Department of Public Health to do additional inspections. And then we're working on with the state to do testing of residents and staff for those facilities with higher needs and those with no cases, because that's the thing. We do have some long-term care facilities that have no cases. So we really want to keep them that way.
Thank you. Cassandra, do you have audio? Looks like you do. Or not. Okay. You know what? I'm going to let that one go, and I'm going to turn to Andrew. What is the VA doing to prevent COVID-19 from spreading through the hospital?
Right, so what most people in the United States don't understand is that the VA is the last line of defense in any type of incident. So if there's a national pandemic like we're in now, or if there was a incursion by a hostile force, we would rely, the U.S. government would rely on local hospitals to take the initial action. And if those hospitals became overwhelmed, the VA would be the last line of defense to take over and start treating civilians. Their primary duty is to take care of our veterans. Like I said, 55% of our veterans today are aged 55 and older, and they are in the high-risk categories. So the VA wanted to make sure that they ensured that staff of the VA was protected, and also the individuals who are currently at the VA were protected from cross-contamination of COVID-19. So the VA closed visits to the senior living communities that are on the Captain James A. Level Federal Healthcare Center in Lake County. They are doing very limited person-to-person appointments, and they are doing basic health checks on all employees and visitors prior to anyone being able to enter the facility. They are also working tirelessly to ensure that adequate testing is done, adequate PPE is being delivered. The PPE that the VA, the Captain James A. Level Federal Healthcare Center, and the Navy base are receiving come from a different supply chain, so they are not actually taking away from the local community. So they are making sure that their supply chain is staying on top of and in front of any wave that might occur during this pandemic, while at the same time trying to keep up with the high level of care that the VA, especially the James A. Lovell Federal Healthcare Center, is known to provide to our veterans.
Perfect. Thank you. There are a lot of questions for Mark, as we should always expect during this. Mark, what do I do if I feel really sick? And if I've tested positive for COVID-19, can I catch it again after I've recovered? And where do I go to get tested? And can anyone get tested?
Yeah, those are really good questions. I think the first thing, anybody who's feeling really sick, I mean, we want them to contact their provider first. And their provider may tell them, depending on what they say to their provider, that they may want them to go into the emergency room, into our ICUs. So, you know, definitely go to the hospital if it's an emergency. With regard to immunity, is that once you've had the disease, we really don't know right now how much immunity you would have, or if you do have immunity, how long that immunity might last. So I think this is a situation where, you know, people still need to be very vigilant about how they're interacting outside where they can't social distance with others. So the nice thing is that the rubric for testing has changed. So, you know, we've had testing expand, and so is now available for people who have COVID-19 symptoms, which is cough, shortness of breath, fever, loss of taste and smell, chills. You know, we've really expanded that list because we found that there's a lot of people that never had a fever but did test positive, or sore throat. Maybe they had a sore throat, but they did test positive for COVID-19. So we have those individuals that are symptomatic, or now it used to be is that do they have a risk factor? And that risk factor would be have they had contact with somebody who has had COVID-19? So certainly essential workers that may have had contact at a business with some other employee, is that they are now able to go get tested regardless if they have symptoms or not. Additionally, people with a compromised immune system or a serious chronic medical condition, they can also go get tested. And then testing is also available for those with or without symptoms. We want to make sure that anybody that works at a healthcare facility, a lot of the hospitals are already doing this, is they're testing their staff quite frequently, because any test is a point in time. So I could be negative today, but 3 days later I could have been exposed and I might have the virus within me and be positive. So it's a point in time test. Also, we want to make sure that people that work in correctional facilities like our jail or prisons, you know, are tested. First, people that serve as first responders, such as paramedics, emergency medical technicians, law enforcement, or firefighters, that we also want them to get tested. And again, as I said, anybody who supports critical infrastructure that you know, really needs to have an understanding if they have COVID-19 or not, because they're on our front line. And the last thing we would want is for those individuals to have COVID-19, may not have any symptoms, but are passing on COVID-19 to somebody else.
Great. Thank you very much, Mark. I really appreciate that. I'm going to try to go back to Cassandra. And the question is, what is the county doing to help residents, particularly those people in need? Do you have audio, Cassandra?
I think so. Can you hear me now?
Okay. I can. Thank you.
All right. So the county has been doing a lot of efforts around helping those in need. For example, a few of the topics that we've been working on is helping with food and diapers. The county's received a lot of donations on food that have then been distributed to the Northern Illinois Food Bank. We've also helped to create an interactive food map of all the known food pantries in Lake County so the general population can find the food pantry that's closest to their home. We're also assisting with securing grants to purchase diapers, to distribute those diapers by Twice as Nice and also to our WIC participants. We created a community action to combat hunger group. It's actually a countywide response to address the unmet food needs of our homebound residents, including our seniors, immunocompromised, or other COVID-positive individuals who don't have family and neighbors to be able to help them out to be able to get food. As far as homeless and survivors of domestic violence, we've been working with the providers that help to house and shelter those individuals. to coordinate meal distribution, to assist with distribution of PPEs, to administer federal funding as quickly as we possibly can to be able to keep individuals in non-congregate hotel-like settings. And we've also helped to develop guidance for how these providers can shelter these individuals safely. And then the final thing, amongst many other, of course, is we've been coordinating volunteer needs. There's a lot of service providers in our county that depend on and rely on volunteers to be able to operate and provide services to the community. We've been able to work with 211, the Lake County 211 platform, to provide a listing of all the volunteer needs in Lake County, as well as a location for any of our residents to go and indicate if they have a volunteer interest. So if anyone in the county is interested in helping out during the pandemic, you're welcome to go onto the 211 website and indicate what kind of skills you have and where you may want to help to volunteer to be able to help provide food or other services throughout our county. So that's just a quick snapshot of the many, many things we've been doing. Thank you.
Thank you very much. And on a call yesterday morning, I think it was, Paul Mazzano, who runs our emergency management agency, announced that we had distributed over 1 million pieces of PPE. So that is great news. It helps protect our first responders and our essential workers. Another question that I had, what will the county do to help hotels, restaurants, and visitor attractions and businesses to get our economy back up and running? So we do have an organization called Visit Lake County. Our county board member, Judy Martini, serves on that, and it is led by Maureen Reedy, who is working with our tourism attractions, hotels, and restaurants on recovery plans that will ensure the safety of our guests and follow those health guidelines that the governor is putting out with IDPH. So they're introducing messages, encouraging 1 or 2 day road trip itineraries to Lake County. Obviously, they're just putting those together. They're not out yet. The stay-at-home order is still in place. And then just preparing for that because our trails are open and golf and boating is also opening up. They're designing a restaurant week time period later in the summer, hoping to give a boost to our local residents. And people can always check out visitlakecounty.org for a great list of things to do, which includes virtual events as well, and a listing of our restaurants offering takeout and more. So we're very grateful for the hard work that Visit Lake County is doing. Next question is for Kevin. I am out of work. Who is hiring?
Great question. So obviously a lot of folks have become unemployed over the last handful of weeks, but there are a number of companies who are hiring. The Job Center of Lake County is collecting those lists, and the number of companies range from Baxter and Takeda to Medline and so many more. So that can be found. I believe the link's being pasted in the window on the right, where you'll find that ongoing list of the companies and the positions that are needed.
Okay, perfect. Thank you. Next question is, again, Donny, you spoke to this in your introductory remarks. You said, I read about the COVID-19 Regional Recovery Task Force. So how does it help Lake?
Okay, I'm going to answer that one real quick and then make a comment. The recovery force includes Chicago, all the colored counties, and it's filled with financial, medical, and municipal leaders. And what they want to do is speak with a united voice when we go down to Springfield, and to let them know what their regions needs to move on. But I'd like to make a comment, and we're running out of time, but I'm looking here at the chat questions. There are so many good questions there, and there's no way we can answer them all tonight. So, I'll make this offer that anyone that has a question related to municipalities, contact the Lake County Municipal League, and I'll certainly answer that question. Hannah's doing a great job of answering them here. The comment I want to make, though, is, people are scared. People don't know what's going on. My wife is battling cancer right now. Her immune system is compromised. She's in fear that other people might not have the same fears. And there's so much debate on, is it necessary? Is it not necessary? Are we coming out too soon? Are we waiting too long? Do we, as municipal leaders, realize that businesses are being affected? Well, of course we do. And many of the municipal leaders are also business owners. So I want to thank everyone for having this meeting, and the questions are just outstanding. I just wish we had more time to get to more of these questions. But again, contact the Lake County Municipal League with any municipal questions, and we'll be sure to answer them. And that's it.
Thank you, Donnie. And I did just send a text over to our communication team asking if we could stay on past 8 o'clock. Sounds like we can. So because a lot of these great questions, quite frankly, are for Mark, right? So everybody wants to know, how can people stay safe? And so this next question is for Mark. How do people stay safe when out in public, and what should we do at home with any purchases or deliveries?
Yeah, I think one of the other things that we just keep talking about over and over is that now with the stay-at-home order, and a lot of municipalities now have mask requirements. So we do want all residents to be wearing a mask when they're out in public and they can't social distance. And so when you're out in public, just make sure you're 6 feet away from others at the health department. Even in our building, we're wearing masks and we're making sure that all of our desks, everything is 6 feet away from each other. But the number one thing that we just keep talking over and over, and our county board member, Ann Main, just consistently talks about hand washing. I mean, hand washing is the number one way to keep COVID-19 away from you, because a lot of people, if you have COVID-19 on your hands, we touch our face many, many times. And so that's how it gets into our nostrils and gets into our bodies, is without really doing great hand washing. So the other things that we can do is that, when you get items from different entities, is that you want to make sure you handle your items with clean hands, use a disinfectant on the surfaces of the items. And then if you're concerned about the packaging, just recycle that outer packaging and place the items on a clean surface. But ultimately, just wash your hands.
Perfect. Thank you. And we will kind of go over 8 o'clock if that works for everybody. So this one is, what are we doing to help businesses that have been closed for weeks and residents who are hurting? So we did have our Finance Administration Committee meeting this morning, led by Paul Frank out of Highland Park. And one of the things we talked about is the funding that we've received, federal funding. So Lake County has received approximately $122 million from the federal government in COVID-19 relief funds. And this funding is obviously public money. It's not the county's money. So we really have an obligation, of course, to develop a transparent set of policies that will provide oversight and tracking on how we spend that money. So we're working to develop ways to help our communities, our residents, and our businesses who have been hurt by this crisis and who will continue to be affected in the months to come. So there are many other ways beyond this $122 million that we can do to help our residents and small businesses, and that's through grants, and there's loans, there's rental assistance programs. And so we are developing essentially a subcommittee of our finance team that's going to be working on exactly what that looks like to help people. So we also today approved a $2.3 million in more federal funding just this morning to support people in our community. That provides forgivable loans to small business, money to homeless shelters, because some of those people in the homeless shelters, that we're now putting them up in hotels, rental assistance programs, like I mentioned, additional food for food banks, and financial services and legal support to help people stay in their homes, as well as support for United Way for 211. So thank you for that question. Let me see. So the next one is, my veteran husband passed away from COVID-19. Where can I get help? And we're very sorry to hear that news.
So thanks, Sandy. Before I get into that question, I saw two questions in chat that I just want to address, just like Donnie, all of us are looking at the chat. One is, I saw a question that said, I have a 92-year-old veteran who needs his primary care appointment because he needs medications. If you have a 92-year-old veteran, have them contact the Captain James A. Lowell Federal Healthcare Center. He already has or should have set up healthcare with his primary care doctor. They will get him any prescriptions that he needs. The other question that I saw was, I filed a claim very recently. What is the VA doing about C&P exams or compensation and pensions exams? The VA is going to do them remotely, very much like we're doing this meeting right now. And if you need more information, please contact my office tomorrow. Our number is 847-377-3344, and we will be able to look at your claim and let you know how it is progressing through the system. Now the question, and I'm again sorry for the loss due to COVID-19, as Mark and others from the president through the governor on down has talked about, is that one of the biggest issues that we have is that COVID-19 tends to attack more aggressively individuals with pre-existing conditions. Unfortunately, with our veterans population, especially our Vietnam veteran population, a lot of them have some of these pre-existing conditions or comorbid conditions, such as type 2 diabetes, non-Hodgkin's lymphoma, lung cancer, liver cancer, due to their exposure from Agent Orange. If your loved one passed away from COVID-19 or due to COVID-19 infection, please have them contact us. Again, our number is 847-377-3344, and we will sit down with you and have a phone interview with you to go through your husband or your spouse's claim and their service-connected injuries and the comorbid conditions they had, and we will help you get the benefits that the federal government has deemed are vital to you due to your spouse's service.
Great. Thank you. And I'm also getting the chat questions. So one of the questions is Lake County in a good position to open business earlier than other counties? And Mark, I know you've talked to us a number of times about we'll know when we're at the right time because of some of these factors as far as from your perspective. Can you speak to a little bit about that, please?
Yeah, I mean, right now what we're having in Lake County is that our ICU beds are still very full in Lake County. So we still have people that are needing to be hospitalized and put on ventilators. So that's one thing that we're looking at. The other thing that we're looking at is the positivity rate, you know, in the different communities like Waukegan. So right now the positivity rate is about 56%. So that what that means is that for all the individuals that are being tested, that 56% of them have tested positive. And what we're seeing across Lake County, and this would be expected, is that as you move west, we have lower positivity rates in some of our more distributed communities. And I know this was one of the questions that we had, is like, well, why is Waukegan, you know, having the greatest number of cases? Well, this COVID-19 disease is really a function, if you look across the world, is where we've had the most cases, is where we have the most dense populations, where you have a lot of people living very closely together. You have a lot of apartments and other places, whereas you move out to Western Lake County, you know, where you have 5-acre parcels, et cetera, there's a lot more distance between the public. So those are two of the main things that we're going to be looking at, especially that's in the governor's plan. Those are some of the metrics, positivity rates, as well as hospitalization, ICU utilization.
Thank you. You know what, most of all the questions that are rolling in here are all for Mark. So the rest of us are going to take a back seat here and make sure we're answering those questions that people care most about. The first one is, are there mental health resources available and have suicides increased?
Yeah, so there's definitely mental health resources available, whether it's at the health department. I mean, anybody can call 24 hours a day, 7 days a week, 365 days a year. They can call our 847-377-8088 line. That's our crisis care program line. Or they can just call 211 and then 211 ask for the crisis care line. So we have counselors available 24/7 that can also direct you to resources that are appropriate to your needs. So maybe you call You don't need our resources, but we'll definitely get you in contact with other community providers or the health department. I mean, there's a lot of other providers out there, NAMI, there is NACASA, there's Gateway, there's Lake Behavioral Hospital. So we do have a lot of individuals or entities that are still operating. With regard to suicides, is that the data is always delayed on death or mortality data. So right now, is there an increase of suicides or not? We don't have that information at this time.
Thank you. Also for Mark, and a couple people are asking like, hey, when are churches going to open and things like that? Again, those are that's the governor to answer those questions. Does Lake County have a plan in place to do widespread antibody testing to see how many people who have actually been infected and to see who may be able to go back to work?
Yeah, that's a great question, Chair. And this right now, one of the issues that we're having with the serological testing or antibody testing, it's a blood draw, is that there's a lot of tests that came onto the market that were never really vetted or approved by the FDA. And so a lot of you may have read that the FDA is taking a look at some of those tests. So at this point in time, we're really not recommending that people go out and get that serological testing because there could be false positives or false negatives depending on the test. Also, the types of tests that are out there, some of them only may tell you about one antibody, others may have 2 antibodies, some may have 3. But ultimately, whatever antibody that is being tested, that there are certain times when you're tested that different antibodies will show up in your body. And so the other problem with this serological or antibody test is that we just don't know. This virus is so new, we just don't know what type of immunity that you may or may not have. And so we don't want somebody to have a positive antibody test and then think that now they can go out and be exposed, but we really don't know how much immunity has been confirmed or conferred to you regardless, if you actually had it, but really didn't have any major symptoms. So the serological tests, we're definitely going to be putting out more information about that soon with IDPH guidelines. And even our hospital systems are validating those tests that they're going to be using. But what the value of those tests are right now, we're still determining what they are or what that is.
Got it. Thank you. And I will try to close us off at around, well, definitely no later than 8:30 so that people can get home. Our panelists are in their offices. So again, for Mark, is there enough PPE for essential workers? And for contact tracers, do you need additional volunteers for that, or how can people help?
Yeah, I think early on, as everybody knows, is at a national level that we had a lot of issues in the beginning with PPE. The great news is a lot of that PPE has come forward. And we just actually celebrated that Lake County Health Department and our Lake County EOC, we just distributed over a million items of PPE. And just yesterday, we received a semi-trailer and another 6 truckloads yesterday. So we continue to really distribute to long-term care facilities because we just find it so important to make sure that those staff are protected as well as the residents. But we've also been distributing it to first responders. We want to make sure that fire, EMS, and police are appropriately protected when they're out working with our residents. Because a lot of our residents have never been tested because they have seen no need because they don't necessarily have symptoms. We've had a lot of people test positive that were asymptomatic or pre-symptomatic. And so we've also been distributing those to other organizations like behavioral health facilities and also individuals that serve individuals with developmental delays. So our supply is improving, but we still have some shortages, especially like gowns. Gowns are really a hard commodity to get to.
Great, thank you. I'm going to give you a break, Mark, because I do have a question for Kevin, so I don't want to catch him off guard here. But what specific grants are available now for businesses, and how does someone apply for them or get more information about them?
Great question. So the one that most people have heard about is the Paycheck Protection Program, also known as the PPP. A business can, including a sole proprietor, can apply for that through either a local financial institution. Not all banks are still taking applications, but several are, Great Lakes Credit Union. Tomorrow at noon, will open up their portal to new customers. That's glcu.org. There are also a number of websites who are now able to to file for those loans. And again, this has potential to be a forgivable loan. You can go to websites like Cabbage or Intuit and Quicken.com and a number of others to find those. There are also a number of much smaller small business grants through the state of Illinois. You can find the links to those programs on our COVID-19 information page at lakecountypartners.com. And there are also other programs from the Small Business Administration, whether it's the Emergency Injury Disaster Loan Program. They also have other programs that are available. So there are a number of programs for businesses that can provide, in many cases, a bridge until the business sales and revenue come back.
Great. Thank you very much. I do have another question that has come up to me, and I know some of my colleagues on the board have heard. When will dog parks open up again? Our dog parks are really popular in the forest reserves. So those, there was discussion about that earlier this week. The CDC, the Center for Disease Control, does have guidelines on their website that actually states that people, do not let pets interact with people or other animals outside the household. They recommend walking dogs on a leash, keeping 6 feet from other people and animals, and to avoid dog parks or places where a large number of people and dogs gather. So that's bad news for those of us who have dogs. So hopefully that will come to a time when we learn a little bit more about this virus and that it'll be safe to get into those dog parks again. I know that having the trails open in our forest reserves has been a wonderful thing for our residents. So, so hopefully we'll find out more about that. And I would anticipate as soon as CDC changes their guidelines that our commissioners on the Forest Reserve, including me, will be looking very closely at that one. Okay, I am back to Mark. Actually, I'm just going to take this one really quick. It says, what are you doing about property taxes? So I'll take that one. So the county board the county is approximately 7% of people's property taxes. I'm really pleased that our board for the 2020 budget year chose not to raise the tax levy for the first time in at least 20 years, perhaps longer. We are striving to do that again for 2021. That's very important. We have extremely high property taxes here in Lake County, and I know every person on Lake County board wants to do what we can to help our residents. So if anybody wants to send, I can give more detail on that, but this is really about COVID-19 and how, we can get more information out to our residents. So Mark, we hear a lot about the similarity or belief that there's a similarity between the coronavirus and the common flu, seasonal flu. Is COVID-19 more lethal than the flu?
Yeah, so right now it's too early to tell. I mean, if you think about it, our flu season runs from fall through spring. And, since the first case we had on March 11th, it's only been 57 days into having cases in Lake County. So one of the things that we really want to point out is that, you have a key difference between COVID-19 and influenza is that we have no vaccine at this point in time for COVID-19. And frankly, we may not have one until January 2021. And it has to be an effective vaccine. And so we really want to get going here for this fall is we want to prepare for fall and make sure that everybody gets their flu shot so that we're protecting people from influenza just in case we have both a wave of influenza and a second wave of COVID-19. But we're definitely looking at the statistics with regard to mortality across the nation and obviously in Lake County.
Great. Thank you very much. We've had a lot of conversation recently about the voting order. Obviously, that's very important to us here in Lake County. And so the question was, did the voting order change to allow more than 2 people? And the order, as my understanding, it has not changed, but the Lake County Sheriff's Office did release a press release yesterday stating that they will not be issuing citations if there are more than 2 people on a boat. But what Sheriff Eidelberg has stated is that he hopes that people, of course, will not take advantage of this by inviting friends and non-family members on their boat. It is still important to have social distancing, and that really any abuses of that or violating those temporary restrictions issued by the Fox Waterway Agency, I don't know enough about what that one is, but it sounds like that could result in the chain of lakes being closed. So if everybody's out there and hoping to boat, just please be smart about it and remember that it's important to follow the governor's executive order. So we're about 8:15. I'm going to return it to Mark, and you've done so much talking, Mark, but I think people came on here. We have still over 500 people, and I think they really want to hear from you. So is there anything that you would like for people to hear that hasn't been touched on so far this evening?
Well, I know a lot of people, and I've just been reading through the comments, is that I know there's a lot of people that are out there struggling, and they're very concerned about the governor's orders and them having to stay at home, and that their businesses, and there's still a lot of fear out there about what this COVID-19 bug can do to our residents. And I just want to go back to the flu shot. There's a number of people that have written in the chat that, well, it's only 30% or 60% effective. Is that what I always say is that any vaccine gives you some immunity, and so I would take 30% or 60% protection over 0 protection of not getting a vaccine. So my hope is that our country or another country can figure out a vaccine for COVID-19 sooner than later. I know there was somebody else in the chat that asked, does the Lake County Health Department have a plan for mass vaccination? And actually we do. We have prepared for the pandemic flu too. We had a mass vaccination campaign back in 2009 for H1N1. So, I certainly understand, and there's a lot of people that, are unemployed, that are not getting paid. But I really just have to thank everybody again, is that if we didn't stay at home and we kept doing business as usual, I think our case count would be way higher and our deaths would also be way higher. So I just want to say thank you to everybody out there in Lake County for doing the best they can.
Thank you. Thank you very much. And if I could ask, maybe starting with Donny, if there's just anything that you really wanted to touch upon really quickly before we start to wrap it up. And it's okay if you didn't. I'll come back to Donny. How about Andrew? Oh, I'm sorry. I'll go back to you, Donny.
Yeah. Just as a wrap up, I just want to say that this virus has brought out the best in people and the worst in people. There's so many scams out there right now. Our police are getting called on. Be careful about giving out any information over the internet. But it also brings out the best in people. I've had several people call me, how can I help? The Grant Township Food Bank has received many, many donations. So once again, we'll get through this. We'll get through it together. But I want to thank you for allowing me to be part of this group. And I think this was a great thing.
Thank you. Andrew Tangen.
Yeah, thanks, Sandy. Yeah, so one thing that we've gotten a lot of inquiry about is how do veterans who have no income get stimulus checks? You have to go to the IRS website and fill out the non-filer application. And also the VA and Treasury departments are working hard to ensure that veterans with no income receive those checks. Also, if you are caring for a veteran, if you are a caretaker caring for a veteran, and you need help, whether it's you need a break for a day, whether it's you contract the virus, whether there's something that's going on that you can't deal with yourself, there are solutions for that. So you can contact our office. Again, our number is 847-377-3344, or one of our great partners with the VA Desiree Cox, and her point of contact, her phone number is 224-610-1469. Again, that's Desiree Cox, point of contact 224-610-1469. And if there are any veterans that are still on this call who need help, whether it be financial assistance, paying your utility bills, your mortgage bills, your rental payment, anything that has caused you to go into a financial hole because of COVID-19 or because of other issues, contact our office. We are statutorily mandated to help you. We are the single point of contact for all veterans in Lake County. My job is to be your advocate. Contact my office and we will help you. And we will get through this together.
Thank you. Thanks, Andrew. And Kevin Constantine, any quick closing comments?
Yeah, just to close, I know a lot of people, both individuals and businesses, are in tough spots right now. I want to reiterate that there is assistance out there, whether it's unemployment assistance for individuals, whether it's business assistance to keep doors open or allow you to reopen. Importantly, that there is money available, especially in the PPP program. That I know the first wave went really fast. The second wave has not. There's $140 billion available, and we want to help you get that to aid your business. As well, then, for those who aren't working, there is assistance to help get you placed with those employers who are hiring. So there are opportunities there. We understand it's a difficult challenge, but there are opportunities for help.
Great. Thank you so much. And just to connect that, to go back to something that Cassandra had said earlier, if anybody wants to volunteer or needs something, do call 211 and they can get you connected. So I want to thank everybody for attending. We have recorded this, and so it will be available. And for those questions that we can answer that are in the chat that we didn't get to, we're going to do our best to do that. But please be patient, because do know that everybody on this panel is working really 7 days a week, really tirelessly on behalf of the residents of Lake County. So we will get those questions answered just as soon as we can. This is an incredibly challenging time. Many people have been saying that. It's something that none of us have ever experienced before, and we're only going to beat it by working together. And as somebody said to me, you know what, the virus doesn't move, people move. And it's about flattening the curve and not overwhelming our medical providers. And I also want to take this time to say thank you, not just to our medical providers, but to all of the essential workers that I think Mark was speaking about earlier today, that enable us to go to the grocery store and there's food on the shelves, and do so many things that keep our lives going. So we're really grateful to everybody, and the best way to keep them safe is to really follow that rule and to stay at home and to wash your hands and just be doing everything that we can to keep everybody safe. So I want to thank our communications department and the county administration team, and really thank all the panelists. You guys are wonderful to work with. I feel very fortunate to have wonderful colleagues across the county who are truly dedicated to helping our residents and helping our businesses, both large and small. So with that, thank you very much for everybody who submitted those questions. They were all very good. We'll do our best to answer them. And thank everybody for doing what you're doing at this very difficult time. And please stay safe, stay healthy, and stay home. Thank you.